Hello, everyone. My name is Katherine Harrell, and I'm the Director of Marketing for Intuit Health and your moderator for today's session. Welcome to Gain the Competitive Edge, 5 Steps for Ensuring an Exceptional Patient Experience, a webcast featuring healthcare customer service expert Kristen Baird and sponsored by Intuit Health, the leader in patient-to-provider communications. Intuit Health brings technology to healthcare, helping to improve your practice efficiency. By shifting routine tasks like scheduling appointments, forms, and billing online, your staff can optimize their time and focus on more critical matters and, most importantly, on your patients. Today, the Intuit Health Patient Portal helps more than 6 million patients communicate securely online with their providers, resulting in a better patient experience. Our clients have often reported higher patient satisfaction rates and increased referrals to their practice since their portal rollout. Intuit is the maker of TurboTax, Quicken, and QuickBooks, and has successfully made complex tasks easy for almost 3 decades. In fact, we are ranked #1 by Fortune magazine in 2012 as the world's most admired software company, and we bring the same innovation and ease of use to healthcare. You can find more about Intuit Health and the patient portal at intuithealth.com. Today's consumers are well informed and have growing expectations, and the patients in your medical practice are no exception. In addition to seeking high-quality, personalized care, patients want to be informed and involved in decisions throughout their entire healthcare experience. And the experience starts with the first interaction with your practice, online or by phone. During the next 50 minutes, we're going to examine how patients gauge quality and what you can do as healthcare providers to create a more consistently positive patient experience while the patient is in the office and outside practice walls. In today's demanding world, the patient experience is quickly becoming a way to stand out and grow as a practice. I'll introduce our speaker in a minute, but first just a quick few housekeeping items. First, today's presentation will last approximately 50 minutes, and we have 15 minutes for questions and answers. Slides from today's session and information regarding Intuit Health products are available in the resource list widget at the bottom of your console. That's the green button with the open folder image. And shortly following the broadcast, a recorded version of today's webinar and a copy of the presentation will be emailed to all attendees. Next, you can submit a question at any time during the presentation. Simply type your question into the Q&A box on your screen and hit the Submit button. If you don't see the Q&A box, just click the red widget at the bottom with the QA in it. Kristen is going to answer as many questions as she can, and if we run out of time, don't worry. We will make sure to follow up with you individually to make sure you get the information and answer you requested. And last, at the bottom of your screen, you'll see some widgets like email a friend and share this. And we encourage you to let your friends and colleagues know about this webinar if you think they would benefit from the information. Now, without further ado, let me introduce our speaker. We are honored to have Kristen Baird here with us today. President of the Baird Group, Kristen specializes in helping healthcare organizations optimize customer service. Through culture assessments and mystery shopping, Kristen helps clients understand the patient experience. Then, using models for service excellence and employee engagement, she guides her clients towards organizational service goals. Kristen received her BSN from the University of Wisconsin-Madison and her MHA from Cardinal Stritch University. She has over 30 years of experience in healthcare from areas including nursing and senior leadership, and she's also an accomplished author of 5 books. So be prepared to be inspired and energized. Welcome, Kristen Baird, healthcare's customer service guru.
Thank you so much, Catherine. It is really great to be here, and I am thrilled to see so many participants on the call today. From what I've seen, we've got everybody ranging from small practices to large academic medical centers. So what this tells me, based on the numbers that we've got on the call today, is that the patient experience is really on people's minds. And it's great to know that so many of you are interested in making some improvements. So what we're going to be doing in the course of today's call is 4 key objectives is what we're going to cover. First, we're going to review how the patient experience will impact the bottom line as well as clinical outcomes. Second, we're going to look at 3 key drivers of satisfaction that are identified through satisfaction surveys. Next, we're going to review the patient portal, or how that can improve the patient experience and help to engage your patients even before they arrive at your practice, and then again even after they leave your practice. And lastly, I'm going to give you 5 important steps that you can start right now to begin making improvements in your patient experience. But before we get into the meat of today's program, I do want to tell you just a little bit about the Baird Group. We work with hundreds of healthcare organizations across the country of all sizes and have the unique opportunity to help them find solutions to their patient experience needs. And what we do primarily is we help them to create a better experience for their patients and for the people who serve them. So it's not just about the patient experience. When we work with organizations, we want to see more engaged employees and more engaged providers. So we help you understand the current reality through culture assessments, which we call the diagnosis phase. That includes mystery shopping, because we want to shed light on the real stories behind the patient experience. And then, getting into some of the service training, employee engagement, and leadership development. So basically, we're helping clients find solutions to their service issues. And it often includes linking them to effective products and technology that can help them improve efficiency. Not only efficiency, but the patient experience and cost effectiveness. And so one of the pieces of technology that I'll be pointing out through today's session is the patient portal. But most of our focus is really going to be on the patient experience component, particularly since it's an area that a lot of medical practices are struggling with. Not only medical practices, but I would say healthcare in general. So we're going to be focusing on that patient experience. And the slide is not advancing, so if you could advance for me, please. It seems that everybody is trying to improve the patient experience in today's environment, and for good reason. It's not enough anymore that you hang your shingle and say, hey, we're open for business. If you want to compete effectively, you've got to be ready to deliver on the patient experience. Remember, healthcare is a service industry. We don't manufacture widgets. We don't sell retail. We provide a service. And so it's not enough to have clinical quality indicators and then sit back and rest in the knowledge that you do great clinically. Frankly, that's expected. That is the business you're in. You're in the medical profession, so your customers, your patients, expect you to know what you're doing clinically. So to compete and to really stand out, you have to do several things, all right? You have to help patients know that that help them feel cared for, help them feel heard, respected, and involved in their care, right? And so in order to achieve that, savvy customers aren't going to be content anymore with treat 'em and street 'em. They want to feel good about the entire experience, which, by the way, begins well before they're actually physically in your building. So some of the reasons why this is all so important are, number one, a dissatisfied customer is going to tell 9 to 15 people about it. And about 13% of your dissatisfied customers are actually going to tell more than 20. Now, these are statistics from Consumer Affairs, and so they are applied to basically any kind of consumer behaviors. It's even tougher in healthcare. The next reason why it's so important is that we know that happy customers who have their problems resolved are going to tell 4 to 6 people about their positive experience. Another reason is that it costs you, the healthcare organization, 5 to 6 times as much to get a new customer than it does for you to retain an existing one. So that's why you want to make your existing customers happy. And another point, customer loyalty is worth up to 10 times as much as a single purchase. And that's, again, with anything. But when we look at the lifetime value of a customer, I'm going to be showing you some more statistics on that in a minute. You have to be thinking about long term. So in other words, great service has a positive impact on the bottom line because you'll be spreading positive word of mouth and you'll be able to keep the patients that you already have. And there's another really important reason why the patient experience matters now more than it ever has in the past. And that is this thing we call CGCAPs. All right, so I'm going to explain what that is. CGCAPs is basically the CAPS part of this is an acronym that stands for Consumer Assessment of Healthcare Providers and Systems. And what that is, what the CAPS are, is it's a family of standardized surveys that ask consumers and patients to not only report on, but evaluate their experiences with healthcare. Now, hospitals have been submitting their patient satisfaction data scores to CMS for the past few years, and the scores have been available for the public to see online. So that means if you're making a decision to go to a hospital, you can go to a website called hospitalcompare.hhs.gov, and there you'll be able to compare one hospital to another for patient satisfaction. And for hospitals, this type of survey is called HCAPs. And starting this past October, a portion of Medicare reimbursement is going to depend on how you score for patient satisfaction. Soon, the same is going to apply to clinics, so clinicians and groups. So the CG part of this stands for clinicians and groups. And basically, there's a number of reasons why this is really important to you. But CGCAPs is relevant to your practice from both a financial and a reputational standpoint, because once it's mandated, it's like it is for hospitals, a portion of your Medicare reimbursement will be withheld if you're not, if you haven't implemented it, or if you're not performing well. So in addition to your practice scores and results being publicly displayed online, you'll have to make sure that they're favorable in order to get your full Medicare reimbursement. And so there's a Medicare reimbursement component that's tied to the results. And it's important for you to remember that the patient experience, it's not just about what comes up on your patient satisfaction scores. It's important to remember all the time that your patient experience is a combination of both the rational mind and the emotional experience. So when we go to evaluate the patient experience, we have to look at both of those things, the emotional and the rational. And so when we describe what that really means is the rational part is let's say I look up my provider's credentials. That's the rational part of my brain saying, oh, this person has, this type of board certification or this many years experience. So that's the rational part of my mind in making a decision about where to go for my health care. The emotional part of the experience is really how the patient felt about their encounter with the healthcare organization. And when we start looking at patient satisfaction data, there are three areas particularly that are very important in looking at the experience. One composite area is timeliness of the appointment or access. The second is the provider's ability to communicate, so the provider's communication with the patient. And the third is the helpfulness and courtesy of the office staff. So when we start looking at HCAPs or CGCAP scores, those are the three composite areas that stand out as among the most important. But it's important to keep in mind that it's not just about the survey. Your culture is the key factor in how you're going to fare on the patient experience. Culture fosters attitudes and beliefs that in turn create moments of truth that ultimately define the patient experience. And when we define culture, I'm going to just define it very simplistically here for you. Culture is really the way we do things around here. The way we do things around here even when nobody's looking. So let me give you an example of how this might look in your practice. So for instance, imagine that you are training a new front office person on phone skills, and she's just finished the orientation, and she's been trained on, we deliver the most patient-centered care, which means we do our best always to accommodate patients. And she's been told about great customer service that you want to deliver. Then she gets out to the practical application of answering phones and scheduling. And she sees her colleague, who has been there for many years, she sees her colleague interrupting the callers, speaking rudely, and perhaps transferring the patient without warning. And the whole time, the manager is sitting within hearing distance and does nothing to correct the behavior. Okay, so what this new trainee is thinking is, wow, I guess that's okay around here. So that's part of the culture. So with leadership in the medical practices, it's important to remember that what you permit, you promote. So it might be one thing that you train on, but you also have to create and sustain a culture where the behaviors you want to see are really sustained. So you're coaching, mentoring, modeling, and managing for the behaviors that you really want to see. Because all of behaviors are impacting moments of truth and ultimately the patient experience. And what do I mean by a moment of truth? Well, we love this definition from Susan Keene Baker's book, Managing Patient Expectations. She defines it as the moment of truth is when your patient decides if you are what you say you are. All right? So moments of truth, are when your patient is saying, are you what you say you are? And face it, most healthcare organizations are going to advertise that they're, lots of things, that they're high quality, that they're efficient, that they're patient-focused. There's a lot of words that healthcare organizations use to describe themselves, and you might use these words in your advertising, you might use these words on your website, in any of your promotions. So if these terms are among the statements that you're making in any of these places, you got to be ready to live up to them. And that means living up to them at every single turn in the patient experience. So the question is, where do these moments of truth occur? And you'll see in front of you a list. And this is just a few of the moments of truth. And let's just take a look at some of these. Calling the organization. All right, when they call, are they getting a friendly voice? Are they getting a human being? Or are they getting a automated call system? Okay, so when they call the organization, what's the experience? Do they have somebody on the phone that's going to show empathy? Do they have somebody who's going to be helpful to them? When they request an appointment, are they getting an appointment for when they want? When they walk through the doors for the first time and they meet the receptionist, is somebody making eye contact? Are they saying hello? Are they smiling? Or do they see somebody that's on the telephone, perhaps texting, which might indicate it's a personal message? What do they see? When it comes to completing registration forms, are they just handed off a clipboard with 20 pieces of paper on it, or what is the experience? So look down that list and think about all of the various touch points that a patient has when they come in contact with your office. Some of them happen before they're actually physically present, and some will happen while they're physically present, and others are going to happen after the appointment. All right, there are several items on this list where, I was looking this over and I thought, wow, there are some real important areas where the patient portal can make a real difference. And some of these are things like requesting an appointment. You can request an appointment anytime that you want. It could be at midnight if that works in your schedule. So requesting the appointment, anywhere where you see those check marks are areas where a portal can support you in managing the patient experience. So for instance, you can request an appointment any hour of the day or night when it's convenient for you to put that online request. Completing registration forms to make it a more efficient point when you go in for your actual visit. That might even cut down on waiting time in the reception area or, in the waiting room. Giving your history, again, that has to do with what you can fill out in advance, or getting your visit summary afterwards, obtaining test results. All of these things are things that can be really important. I find that patients can really get overwhelmed with a lot of the information that's given during an appointment. There might be a lot of information coming at them. So another really positive aspect of the portal is that visit summary. And this way a patient can, log on and review the key information that's not only helpful in communication, but it actually reinforces the treatment plan. And then following up about lab results, test results. One of the biggest dissatisfiers we find when interviewing patients is that they don't know when or how they're going to get their lab results, who's calling who. The portal's a great way to help facilitate that, getting them timely lab results. And again, it not only improves the patient experience, but some of these cut down on the volume of calls to the practice. So you can see that if people request an appointment online, that might cut down on the volume of calls and the length of calls, but then also people calling in for their lab results as well. So and don't be fooled into thinking that this is just something for younger people that are very tech savvy. I can tell you my 84-year-old mother makes good use of this feature, not only to get her lab results, because she would rather go online than have to call several times, but she also uses it to pay her bill and to request her her prescription refills. So it's not just younger people who are using this. It's becoming more and more popular with the older population. And the other piece about that is the appointment summaries. A lot of times with my travel and my job and everything, I want to stay apprised of what's happened when my mother goes in to the doctor. So she and I can go over those visit summaries together. But in addition to all of the things that are listed here, I want to emphasize that there is a huge human component to creating a consistently positive patient experience. And in the Baird group speak, we call this E to the third power. This is the human factor where the service skills really come into place, where you have to strive to achieve in your culture that there's consistency with your processes and behaviors, and we call it E to the third power. Every encounter, every customer, every day. That is the consistency that's needed to protect your brand, to protect your reputation, and ultimately your bottom line. So you want to make sure that things are happening consistently so that your patients know what to expect. And if you're a leader of your practice, you can't leave this up to chance. It's vital that you know what you can do to strive for more consistency in the patient experience. And why is this so important? Well, I've cited a few examples in the previous slides, but you can see that if we look at why customers tend to leave an organization, the vast majority, 69%, leave because of an attitude of indifference from the staff or the organization. The next most common reason is they're dissatisfied with the product or service. Now remember, we are a service industry. So if you look at just the two biggest wedges, those are things that really matter when we're talking about the patient experience. And when we think about how it hits the bottom line, you not only think about just one practice visit. I want you to think about the lifetime value of a patient. This is huge. This is huge because think about the lifetime value of a patient. All right, and here's a basic equation. Basically, let's look at multiplying the charge per visit times the number of visits per year times the average life expectancy. When we look at the data out there, we know that right now, let's say your average charge per visit is $75, and the data shows that the average number of visits per person is 4 times per year. And then if you multiply that by 78 years of age, you can see where right now in today's economy, that's $23,400. That's a lot of money. But let's imagine, too, that this is a young woman who is going to make lots of health care decisions over the course of her lifetime. She's going to be making decisions for herself, possibly her children, her spouse, and aging parents. So the bottom line impact can be well over $100,000 if you are, let's say, a woman who's going to be making decisions for her family. All right, so the bottom line impact of the patient experience is significant. So it's important that we really understand what goes into that patient experience. So medical practices across the country are looking closely at patient satisfaction. They're measuring it with surveys. They're calling on survey vendors. So I reached out to one of those survey vendors, Avatar International, and they're a survey vendor company, and they were willing to share some key data with me that I could pass on to you. And this slide basically represents the composite of thousands of individual surveys in thousands of medical practices around the country, and looking at all of their survey results from medical practices. And what this shows is there are lots of different things that go into overall satisfaction, all right? And you can see from the highest to the lowest that, problem resolution, did you resolve problems while the patient was at the practice? When they were leaving the practice, did they have the information that they needed? The next one is physician care, then tests and procedures, the office staff, the environment, the appointment, getting around, the lab, including the lab results, and then billing. So those are all the different dimensions. And when I looked at these, I thought to myself, all right, those are the important pieces of the patient satisfaction survey. Where could the portal actually support you? And I put check marks up where the portal could actually support you in resolving problems, in leaving, because you can have the visit summary. In physician care, again, the visit summary is an area where you're reinforcing that. The tests and procedures is where you can get your lab results, and so on. So there are a lot of different areas where you can see where the portal will overlap. There are many things, and there's an art and a science to enhancing the patient experience. And when we look at some of the key areas, one of the key areas is on access. And so patients, will be wondering, is anybody there? Do they care? Who can help me? Can I get in when I need to? Those are some of the questions in the back of the patient's mind when they call in for assistance. And patients can tell in an instant if the scheduler cares about them, even if it's just a phone call. If they care by the tone of their voice, and whether they, care by whether or not they go above and beyond to meet their needs. But your culture influences access. And how? Well, there is a direct link. You have to ask yourself, is the staff knowledgeable and comfortable with scheduling? Are they comfortable and knowledgeable about insurance information and in problem solving? So it's not just about whether they get an appointment. It's the whole experience around making an appointment. We did a focus group a few months ago where we found that patients weren't able to get in for things like physicals for up to 6 weeks. And they'd be frustrated, and they would say to the staff, well, can I get in any sooner? And the staff would say, just keep calling back. Well, you can see that you're putting the responsibility on the patient, not owning the responsibility among the staff to meet the patient's needs. So you can see where that would be a big problem. But not only that, you're creating a higher call volume. So if you're telling patients, call us back, some of these patients were calling twice a day. And so they discovered that it wasn't, just about, getting the appointment the first time. It was about how they were, going above and beyond to meet the caller's needs. And your culture is going to drive how you set things up. So in this particular case, we learned that the staff wasn't using the available technology, all right? So we also know, too, that making an appointment can take up to 10 minutes and sometimes involve more than one staff person if you have additional questions and so on. So you have to give people the skills and give them some coaching on the fundamentals of how to use the technology, but also the soft skills. But you can see where if you are using the portal to request appointments, you can really cut down on the length of calls and the number of calls. So, so when you're working with a portal, it can be requesting it. That reduces the number of inbound calls, and then patients can explore the options on their own time. So it really can help to improve. The next area is office courtesy, office staff courtesy. Remember, access, and courtesy are judged before they ever see a provider. And it sets the stage or the mood. The staff courtesy at the front desk is a real influencer about that patient experience. And what's on the mind of the patient is, do they really care and can they help me? So that front office person is really influential in setting the stage for the patient experience. And the culture is going to drive that experience because, it's things like hiring. Are you hiring for service-minded behaviors, or are you just looking at the resume and saying, oh, this person has a lot of experience? Well, they may, but maybe they don't have the behaviors that you would really want to have for all of your staff. Then the next thing is, are you training? Are you training consistently, or is it a one-time thing that they get at orientation? And for somebody that's been there 5 years, they haven't had any additional training. And then the other piece, probably even more important than the training, is coaching. As a practice manager, are you coaching, mentoring, modeling, managing for service behaviors? And are you setting specific performance expectations for your staff? What we find in our focus groups and mystery shopping is, as we start to drill down, people are not holding staff accountable. And so that's where things start to fall apart. So the next one that's really important in this whole equation is provider communication. And what's on the patient's mind is, do they care? Well, providers have to show it in ways that are meaningful to the patient. Will they be able to help me? Do they know what they're doing? So they want to know that the doctor is competent. And then lastly, help me understand. I'm confused. I've got lots on my mind. So what is the provider doing to help communicate effectively in all of these areas? One of the things that we teach is commit to sit. When coaching physicians to improve their patient interactions, we strongly emphasize this because they should sit at eye level and give that patient their undivided attention. With teaching commit to sit, there are a lot of things that can be achieved. We know from the data that patients perceive the interaction to be longer and more positive when the provider sits. And then only 61% of the patients whose doctors stood actually rated the interaction positively, and 95% whose doctors sat rated them positively. So it's something to keep in mind. I can tell you that my mom goes to a doctor who does this extremely well. She sits down with her, she makes eye contact, often touches her arm, is very reassuring. And I compare that to a time when I had to take my sister to see her doctor, and her doctor unfortunately was out, and she had to see the partner. And the partner opened the exam room door, stood at the door with his hand on the knob, and that's how he conducted the encounter. We felt devalued, we felt rushed, and absolutely insignificant. And so it really does make a difference in that interaction. And when I say commit to sit, I don't mean just the doctors. I mean the medical assistants, I mean the nurses, that when you sit and you make eye contact, you engage with the patient on a much deeper level. We also teach this. We want everybody to be great in every encounter. And we use this acronym to structure an encounter so that people can remember to greet, and that means using their name, introducing themselves. R stands for Relator Recap, make small talk, or relate back to something that was from a previous visit. Explain what you're doing, because this is, when we work in healthcare, we're very accustomed to the things we're doing, the sights, the smells, the terms. We have to make it a point to explain what we're doing. And I like to tell staff to talk while they work. So I'm taking your blood pressure. I'm going to be drawing a blood sample. All right, so explain what you're doing, and then ask them, not do you have any questions, but what questions can I answer for you today? And keep it open-ended so that you're really inviting them to talk. And then last, tell them what to expect next and thank them. And again, telling them what to expect next often gets down to that communication about lab results. Oftentimes we don't even do a great job of concluding the clinical encounter. We end up the provider walks out of the room and the patient is left there wondering, am I finished? Should I get dressed? Am I done? Or they leave thinking, wait a minute, when did they say the lab results would be ready? Or who's calling me? Or am I calling them? So make sure that you take the time to summarize and tell them, and then thank them for choosing you. We had a great encounter when I had my sister in for a medical exam, and I'll never forget. The person, when I said thank you, they turned to me and said, no, thank you. We know you have a choice, and we're always so honored when people choose us. So that's just an important skill that you can teach your providers and everybody on your team. Communication is, there's a flow to communication that happens before, during, and after your patient encounter. And there are various communication tactics that set the stage for the visit. And let me just explain. Okay, there are some that happen before the patient ever arrives, and that's when the patient, has made the decision, I need to reach out to my provider. And they reach out to your practice. They're going to either call or they're going to go to the website. But either way, communication has begun, right? But that's before the physical encounter. Here, a phone call is going to allow the patients to schedule, depending on the attendant. They may also give things like directions. So on the phone or online, you want to do scheduling. If they're on the phone, they might be able to schedule on the phone. If it's the portal, they would be able to at least request an appointment. But that's before they make a physical encounter. And depending on the initiative that the staff takes, they might even actually give them directions. But then during the visit, there are so many opportunities to connect with the patient for good communication. And that's between the patient and the staff, the patient and the provider. There's lots of different opportunities. They begin at registration, and then they continue throughout the entire on-site encounter. But typically it includes the nurse or the medical assistant who will actually, there's registration, of course, I mentioned that, where you want to make sure that they have direct line of sight when the patient walks in the door. You want to make sure that they're smiling, that they give a verbal greeting, that they create a welcoming environment. The other one is the medical assistant or nurse who's rooming the patient. Do they engage them in conversation? We had one when we were mystery shopping a couple of weeks ago where they called the person's, or the nurse went out to the waiting room and pointed at two of the people in the waiting room. She goes, "You and you, come." And then she walked them in through the first door, and she said, "You," and she pointed at the mystery shopper, "Stay." And then she said, "You, come." And that's how she was talking to the patients. And it really struck us that, I mean, that is an important person in this whole patient experience, if that's how you talk to people, versus the one who said, well, it's such a wonderful day, it's good to see you again, that kind of thing, and then reminding the patient, well, my name is Chris, and I'll be taking you to the exam room. You might even say something about how long you've worked there and what a great practice it is or something like that. But that is during the encounter. Then after, there are things that you can have at the close of the visit, and that includes things like instructions. Okay, you might hand them paper instructions when they're leaving. You might hand them paper that says when your lab results will be ready. But then they can go online and do any of the things afterwards. So what's neat about this is that if you interface great service behaviors from your staff and your providers with the technical aspects of the portal, you've got a real winning combination, because then they can access this information even when your staff isn't available. Patients still have access to important information. So I find this to be really helpful with my mom's care. Like I said earlier, I can go back and I can reference the medical record with her. I can look at lab results, all of those things, and help guide her care. So, communication is probably, top of the list when it comes to managing the patient experience. I was at the ear, nose, and throat doctor just last week, and it was kind of funny because they must have just put in a portal, and the person said to me, "I'm supposed to ask you if you want to sign up for this," instead of saying, we've got this great new thing that lets you access your medical records. I thought that was kind of funny that she would take that position, but it can really help improve communication, and that's really vital to patient satisfaction at all of these different areas. So there's lots of things that it can be used to improve on, but I think it's important that if you're the leader of your practice, that you look at your patient experience and you really answer these questions honestly, and that is, do your staff know what is expected of them? Do they know how to do what's expected? And do they want to do what's expected? So when I say do they know what, do you have standards in place? Do they know how? Have you done the training? And then want? Are they a good fit? Do they have good attitudes? So there are 5 steps that if you're the leader of the organization, 5 steps that you can take right now to start improving the patient experience. One is gain a greater understanding about the current reality. What is it really like right now? And I say go beyond the surveys. The surveys are really important. They're great in giving an indication of the patient's satisfaction, but you have to assume that your surveys are going to be asking the right questions. In addition to surveys, we recommend that you start to look at other methods to expand. Do interviews with your patients. Do experience mapping. Do mystery shopping. So, for instance, in interviews, you might ask, what's most important to you about your visit? And, what can we do to improve? What are some things that we can do better? Getting some of those questions answered. The other thing that I mentioned is experience mapping, and this is a tool that we're going to be sharing with you. And here you can see the columns are what is the action, what's the expectation, and what's the encounter actually like. So let's just take, for instance, you go to register. You're going to you expect that somebody's going to listen and help, but then when you get there, the receptionist barely looks up at you. And just hands you a clipboard, positive or negative. Well, that was negative. Next, you enter the waiting room, and you expect that you're probably going to wait 10 minutes because that's been your previous experience. But the actual encounter is the nurse calls you back in 3 minutes. So positive or negative? It's positive. The next step is you walk to the exam room. What you'd expect is a courteous staff person, and what you get is the nurse just points to the scale and without a word just gestures for you to step up on it. So you can use this tool. You can copy it and use it to map out your own patient experience. The next step is managing first impressions. This is huge. They shape the patient encounter, and we look at 3 categories around this: people, process, and place. And with people, we know that you need to be accessible by phone and upon arrival. Is there a friendly, smiling face? You can manage this. This is what you need to do to manage that first impression. Make sure somebody's visible when you walk through the door. Okay, so managing that first impression with people is being accessible. The next one with process, what's the paperwork? Do you have a ton of paperwork? What's the wait time like? Are people backlogged? Or do you have pretty efficient throughput? What's the place like? When you're managing first impressions, you have to look at, are you clean and clutter-free? Is there adequate seating? And I think about bariatric chairs, having wider chairs because we have a larger population. A lot of people are bigger. Are the seats raised so that an elderly person can get in and out of the chair without any trouble? And are there diversional activities like reading materials? So what is the organization like? And when I talk about first impressions, I like you to think 5 senses. What do they hear, see, smell when they come in contact with your organization? Then the next most important thing is managing wait time expectations. Now, people want to right away jump on how many minutes do they have to wait, when in fact you can do a lot to improve the patient experience by managing the expectations. And there are several points where you can do this. Manage means keeping the patient informed about how long will you be waiting. And you can do that right away when they check in. So you can say, we're running on schedule today, so you should be called back in just a few minutes. Or you say, we're running about 20 minutes behind. So let them know right up front. They're going to be more frustrated with you if you don't tell them than if you do tell them and you're managing that expectation. So do manage it from the get-go. That's going to be much better for everybody concerned. During the waiting room, have a standard where you're going to go out there and you're going to touch base with them and ask about, or let them know, this is the game plan right now. We're running about another 15 minutes behind, checking in with them. And the next one is in the exam room. People are on to us about the game we play, putting them in an exam room, and the wait continues. So have a standard there to check back if they've been in there more than 5 to 10 minutes. And then checking out, at the checkout, when will labs be ready? And communication with the primary care, with the provider. Make sure that, it's not just about time. It's about the experience in your waiting room. What are people hearing? This can influence their perceptions as well. Are they overhearing confidential calls? Standards. I talked earlier about having standards in place. Do your staff know what to do and how to do it? These should be behavior-based so that you can see. So, for instance, if you want a welcoming environment, maybe your standard is we look up, we make eye contact, we smile, and we give a verbal greeting. Those are behaviors, and you can measure those. You can train for them and measure them. And they need to be clear about what the expectations are for everybody on the staff. And they need to be incorporated into the job description and the performance appraisal, because if you don't do that, it's just fluff, all right? So if the standard, let's take a standard, let's say it's respect. A lot of people have the standard of respect, but you have to quantify what that is. It means our medical clinic way, it means you make eye contact, you smile, and you listen to people without interruption. So set those standards. That's really important. And last but not least is engage your physicians. Your docs have to be on the same page as your managers and your staff. I think that employees of every organization I've ever worked have asked, well, what about our doctors? What about the providers? It's important to get them engaged in defining the ideal experience. So we want to create a shared vision, okay? Clarify their role, and part of that is not just how they behave toward the patients, but it's also being unified with the practice managers so that staff are getting clear, consistent messages, whether it's from the doctors or providers or their managers. They're an important part of the patient interaction and the leadership role, but when providers model great service behaviors, you can expect more of your staff to demonstrate them more consistently as well. The other thing is aligning the code of conduct. A lot of organizations have a code of conduct with their physicians, but when I look at it, it's really all about disciplinary things. It's about disruptive behaviors. It's about the things you don't want. When you set standards for your staff, help the physicians to set some standards too for the medical staff. What are the behaviors you want to see more of? So those are some of the things that you can do those are the 5 most crucial things that you can do to really start to shift the patient experience in your practice. At this point, I'm going to stop and I'm going to open up for questions.
Thank you, Kristen, and thank you to everyone in the audience. We hope you found the last approximately an hour educational and informative. I know I did. There are a lot of great questions coming in. We're going to open up the floor for Q&A. And if you do need to log off before we're done, please be sure to take a few minutes to complete our quick survey. The information you provide is really helpful for us to be able to improve for our future webinars. Once again, submitting a question is easy. Simply type your question into the Q&A box on your screen and hit submit. And again, if we don't get to your question in the next 10 to 15 minutes, we'll follow up with you individually and make sure you get your question answered. So the first one, Kristen, it came in and it said, what are your thoughts about employees using cell phones during work?
I have very clear opinions about that. I don't think they should. They should be left in the locker, in the purse. If you're sending the message that we are truly patient-centered, I think cell phones can be a terrible distraction. There are exceptions. If you have a sick child, you might want your phone on vibrate in your pocket, but that should be about the only exception. I have heard providers complain to me a number of times about how frustrated they are with trying to get their staff to be really focused on the patients when they can hear them slipping into an empty exam room and texting. So I say just eliminate the distraction. It's really not appropriate. So if you're a culture that says we are truly patient-centered, then that's where the focus needs to be during the course of the workday.
Great, thanks. And I do see several questions coming in, so just to repeat, we will be sending out a recorded version of the webinar and the slides following the presentation. I know there are a lot of people asking about those, so you will be able to get the information via the email you provided. Next question, Kristen. If we do mystery shopping, should we tell any of the staff?
I think it's important to be transparent. I think that if you do mystery shopping, it's important to tell the doctors and the staff. But I just recommend that you put it out there and say, part of our quality assurance is that we are going to be doing mystery shopping just to see, what things look like from the other side, and it's just part of our quality assurance measures. So sometime over the next year, we're going to be doing mystery shopping. And so if that way, people don't feel like you've done something subversive, that you've put it out there for them to, they know what's expected.
Great. Next question. We're a small practice, and our front office staff is often on the phone when patients enter. It's hard to engage with the patient when we're all multitasking so frequently. What is your advice?
That is so common, and I guess my thoughts are twofold. One is, first of all, look at, are your staff really multitasking? Is that absolutely necessary, or could you do a reallocation of work so that somebody can be focused on patients coming in and then staying connected to the patients waiting in the waiting room? So that would be one question. The other thing is working on some of the soft skill training, and by that I mean, are you teaching them how to handle that? So, for instance, let's say I am the person on the phone and a patient is walking in. Have I trained my staff that they can, just kind of smile and give a signal with their finger that I'll be with you in just a minute, or creating a standard where you say, will you put your caller on, say, may I put you on hold for just a moment, and then you turn to the patient at the counter and say, I'll be with you in just a moment. If you'd like to have a seat, I'll call you back, or if you don't mind standing here, I should be wrapped up in just a moment. Again, teaching them those skills, reinforcing, being there to coach them.
Great. This is a tricky one. How do we handle when we have a difficult or abusive patient and still come across as we're providing good service?
I think, again, that gets into a lot of the training. Especially on the phone, we do a lot of telephone training and a lot of soft skill training. And, there's an art and a science to this. And one of the toughest things is to teach your staff some skills so that they feel prepared to handle these things. Some of these folks have never had that kind of experience, so you have to role play. You have to help them be prepared. When somebody is truly abusive, all right, so using foul language or something, and they're truly escalating, we teach a process where we say, sir, I have every intention of helping you with this. I really want to be able to help you with this. I'd appreciate it if you could use a softer tone with me because I'm on your side. I want to help you. If they proceed to be abusive and swearing, it is appropriate to say, sir, I'm going to have to end the call. I invite you to call back when we can have a much more civil discussion. And so there are exceptions, but what I don't want to see is people jumping to terminating the call before they've exhausted other options. So we actually teach a technique that we call low and slow, teaching them to lower their tone of voice, slow the speed of their speech, and to be able to, because when you do that, people tend to mimic. So if the patient escalates and then you escalate, it just kind of goes into a vicious cycle.
Great, thank you. What is a reasonable time frame for patients to expect a callback for a non-urgent triage matter? Is there a standard out there in the industry that you recommend?
I don't know if I don't know the answer to that question. I don't know if there's a standard. I do know what we teach, and that is same day. All right. I think that even if it's not urgent, there are some that put it off to the next day. We would like to see not only same day, but within an hour. All right. That would be the ideal. This is where I've grown very, very fond of secure emails as part of the practice technology, where people can submit a concern or a question where they're actually being screened by one of the nursing staff and presented to the provider. But that can help streamline things significantly as well.
Next question is, what's the best way to approach an MD who is not on board with our behavior standards?
I think where the manager takes that person aside and lets them know where the discrepancies are. I think the most important thing, when we teach these techniques, we use the acronym COACH, where you clarify what the objective is or what the standard is. The O stands for observe. What have you observed? So you're going to give them specific examples. The A stands for action steps needed to close the gap. This is where you're going to coach them and say, what do you think you need to do to change this? The C, again, communicating back to them, giving them feedback on what you've observed. So it's hard to jump into like training with physicians. The best thing is to get them on board first. Get them thinking about the vision. Get them engaged in saying, we're all in this together. Because if they don't see their role, they don't see the importance of their own behavior, you're not going to get the kind of changes across the board that you need. But my first choice is always to get them on board before you even roll out the training with staff.
Next question is, what is a good percentage of patients that you should survey to get a reliable result? And then how often should you do a survey?
There are different schools of thought on that. And, I had mentioned Avatar International as a survey vendor. There's also several out there. And they're the ones that have the expertise in looking at what the sample size needs to be. I know that some practices only survey maybe twice a year. For me, that snapshot in time can be somewhat useful, but not nearly as useful as an ongoing survey where you're sampling constantly. The other piece of that ties back to what you were asking about before about how do you handle physician behaviors. When physicians can see this is how their patients score them, and they can see how that compares to the other physicians in the practice, I think that, again, sharing that data with the providers, it does an awful lot to help influence in changing behaviors that you want changed.
The next question is from a larger practice. It says, we're a large practice with multiple offices. What is your advice on an automated telephone system and distribution of calls across a large network? Can you share best practices with designing an automated telephone system?
That is not my area of expertise. I think that instead of me trying to answer that and give you, I don't have the benchmarks. I don't have the best practices. But what I will tell you is let's go back to what the patient wants, okay? What the patient wants is prompt access, all right? And so across virtually every industry, when the phone call is answered within 3 rings and when it's answered by a human being, that is the start of the positive encounter, all right? The next, probably most important piece of it is, will one call do it all? If they're calling, what is their experience really like? I mean, there are 2 reasons people call your practice: for information or to schedule an appointment, all right? They want their needs met, and they want them met efficiently. So, as far as distribution, that's really going to depend. It's going to depend on your system. It's going to depend on the number of locations. The big question is, who's, meeting the patient needs.
The next question is, do you call patients the day of their appointment to inform them of delays? I think I was also not should you, or what's your point of view on, hey, we're running behind, and letting them know that the doctor might be an hour behind?
That's excellent. I think that that's excellent management of patient expectations. So, for instance, I think about the number of times with OBs where the doctor's in there doing an emergency C-section, and you know how long that's going to be. Why not call the next person, to say, hey, the doctor's been called. I mean, this is not rocket science. You know that there is a delay that's going to be approximately this long, and you know that from history, so why wouldn't you? And that way you are putting the patient back in the driver's seat so you can say, here's the situation we're in, and here are your options, all right? You can come in 45 minutes later, or reschedule. All right, so you're, again, giving them some sense of control.
I have literally had 4 questions come in, all asking if you could repeat the coach steps.
Oh.
Would you mind just walking through those one more time?
No, that's
clearly
fine.
Want to capture those.
All right. So the first C is to clarify. This is where you're clarifying the standard or the behavior that you want to see. All right. So let's just give you an example. Let's say the doctor never introduces himself or herself. And so one of the things you do is you clarify. Our standard is we always introduce ourselves, no matter who you are, whether you're at the front desk, the MA rooming the patient, or the doctor. And my observation is that of the last 10 patients that have come through, you have only introduced yourself one time. So the O stands for observation. This is where you're doing the facts. You know, you're giving them quantifiable data of what you're seeing. The A stands for what actions are going to be needed to close the gap between what you want to see and what you are seeing. All right, so what actions? So you would say to the provider, or let's say the staff too, you know, what do you think you need to do in order to be more consistent on this? Because our expectation is this happens 100% of the time. So you get them involved in creating some action steps. The second C is communication. So you're going to communicate. You're going to close that loop and give them feedback on what you've noticed. So if you've just talked to somebody about you haven't been introducing yourself, I've noticed that, 8 out of 10 times you didn't do it. You've talked about what actions they need to take. Then you're going to give them feedback. Let's say, I'm going to check back with you next week and let's see how this is going. You communicate back to them, hey, I have been watching and I noticed that you have done, 100%, this is a great improvement. H stands for help. This is helping to remove any barriers that are legitimate barriers. This doesn't mean do it for them. It doesn't mean enable them. It just means if they present a legitimate barrier that is preventing them from delivering on the service standard, that you help them to remove that barrier. So clarify, observe, action steps, communication, and help.
Great.
And by the way, if that is all in my book, Raising the Bar on Service Excellence.
Next question says, how do you ask a patient if you can interview them? And when would you suggest doing it? And there are a couple of things thrown out. Between the patient seeing the provider and the patient being discharged, when's the right time to actually interview that patient?
After they've left, or after they've concluded the reason for their being there. Because that way they can give you feedback on what their experience was really like.
In your professional opinion, how many questions should you have on your survey? It says our survey is 3 pages long.
Well, I would turn that back to how likely are you to fill out a 3-page survey? I'm not, okay? So when you look at the CAPS surveys, they have a certain number of questions that are mandatory. So you have to have those. But I would try to keep that short and sweet and keep it, to what's most important. So if you have to prioritize, it would be communication with the provider, access to the services, and courtesy and respect of the office staff. I don't really have a magic number, but I would try to keep it, as low as possible.
Next question says, our patient schedule is based on 15-minute appointments, but nearly all of our patients come in with multiple issues. Our average wait time is an hour or more. How do you recommend we get to 15-minute appointment times in order to increase provider and patient satisfaction?
Well, if you're dealing with a lot of comorbidity, there's a lot out there today in disease management, and some are very successful with group appointments and things like that. Really, I am not an expert in doing the practice efficiencies and scheduling. Mine is really about the patient experience. So my focus in this conversation would be on, oh my gosh, an hour and 15-minute wait is way too long. So there are some processes that you need to have in place, but in the meantime, my first question is, if they are waiting in your in your waiting room that long, what are your standards for keeping them informed about the wait time? What's the waiting experience like? Are they comfortable? I've been in practices where patients have had to wait up to 4 hours. They don't have fresh drinking water. They don't have ready access to bathrooms. I mean, these are basic human needs, folks. So I would say focus on, if they are waiting, what can you do to make it more enjoyable or tolerable right now? But then by all means, you have to look at, what you're dealing with. And if you know somebody has a lot of complications and that they're coming in, to do what you can to collect as much information up front as possible. And some of those things we talked about earlier, are there ways to collect some of that information through the portal up front, so that some of that background history changes, those things are already collected, so you're not causing even more wait time.
Kristen, you talked about the importance of eye contact. One question just came in and said, how do you measure that?
You can see it. I mean, when I'm coaching my staff, if I expect them to look up when somebody walks in the door, make eye contact, with my staff, I would be as their coach, I would be watching that. With the provider, you're probably not going to be in the exam room to measure it. You're going to set forth as an expectation. And let's say your provider's patient satisfaction scores are coming in. They're going to ask questions about the courtesy and respect of the physician, and those that are not as high as they should be, that may be one of the reasons. That's why I say drill down, do some interviews, talk with the patients, do some mystery shopping. I found that with mystery shopping, it gave me a lot more material that we could use to coach the doctors. So the other thing, too, is sometimes the mystery shopping helps you to reveal who are your real rock stars. And so when you're talking about changing the culture, you end up being able to get the real star performers to be able to help coach the other physicians.
And we are almost out of time. So last question, what is the effective date and timing on the CAPS survey for medical groups?
I don't have an answer, and right now, to my knowledge, I don't think anybody does. There is the first version of this where there's a couple of states that have been doing the CAPS. Massachusetts has been doing something similar with public reporting for a number of years, but I know Minnesota is one right now. But if you go to Physician Compare, if you just Google Physician Compare or CGCAPs, as I had it on the slide, you'll be able to see some of the most current information. But I don't think, to my knowledge, I don't know if there is a deadline date where it's going to be live. The best advice I can give you is to start working on your patient experience right now, so that you won't be at the bottom of the barrel when it comes time to have to start publicly reporting your scores.
Right. Again, there are still questions coming in. We are out of time, but we will follow up on each question that was submitted with each person individually. Thank you so much for all of the great questions you submitted. And thanks to Kristen. As I previously mentioned, the slides are available to download in the green resource list widget at the bottom of your screen. And shortly following the broadcast, you will also receive an email with a link to the recorded version of today's session and a copy of the presentation. The email will be sent to the address you used to register for the webinar. And if you'd like to learn more about Kristen and the services she offers or her books and training resources, you can visit www.baird-group.com. You may also connect with her on LinkedIn, Twitter, and Facebook, and check out her blog at her website, baird-group.com/blog. And if you'd like to learn more about the Intuit Health Patient Portal, also visit our website, intuithealth.com, or you can contact us at 877-599-5123. On behalf of Kristen and Intuit Health, we hope you enjoyed today's webinar. Again, please take a minute when you log off to let us know how we did and how we can do better. This concludes today's presentation. Thank you and enjoy the rest of your day.